Dear Uzoma Asagwara, in my correspondence to your offices in May and June, I indicated that I still don't know how or when I may potentially access the healthcare and health benefits I need here in Manitoba. I explained that there are no specialists accessible to me or others, and also highlighted the many ways I've been failed by this province as a whole through policies, procedures, organizations, and legislation, and by many, many medical practitioners within the healthcare system. Although I appreciated your staff responding by phone on June 16th, they were unable to offer a meeting, which I had suggested in my phone call on June 13th, or any tangible support, and no action was taken on any promises they did make. This includes my specific request for greater awareness surrounding my complex health conditions. There's a strong potential for positive change when people come together to ask the question of what can be done or what can we do, and I remain willing to work together. That being said, in a recent article entitled Manitoba Lipedema Advocates Want More Support Healthcare Coverage in Canada, another artist says something I've articulated many times, which is that it should never be this hard to find healthcare. And you yourself respond by saying, quote, "We know that part of the challenge with lipedema care, not only in Manitoba, but across the country, is lack of education, awareness, and understanding. We want to make sure that providers understand what that looks like and what is needed. We want to make sure that we're listening to the lived experiences of those who are navigating this as their healthcare journey. So we're going to keep listening, working together, and finding ways that we can move Manitoba in a better direction." End quote. How am I not to feel discriminated against once again when my healthcare and conditions are being treated so differently? Providers refuse to acknowledge what is needed for my care, so I must complain for this to change. I've repeatedly expressed how this province's failure to remove barriers to accessibility for me as a disabled individual has negatively impacted my access to healthcare, justice, and my life. Unfortunately, this provincial government continually seems uninterested in any standard of accessibility or in educating themselves about the needs of disabled individuals. In fact, what has been repeatedly demonstrated is that the needs or rights of disabled individuals aren't taken seriously by them at all. I have many reasons to believe that my provincial government totally devalues, consistently misunderstands, and does not care about providing even the most basic needs for people with disabilities to exist in community with equity and equality. I have been given no reasons to believe otherwise so far, and would love for this to change. When this government is challenged, they not only refuse to accept responsibility for the harm caused by lack of accommodation, but make excuse after excuse for their actions. I wonder, would your party question someone wearing glasses as to whether it'd be okay if their glasses were removed a few feet from their face? Although the minister overseeing accessibility has apologized for recent harmful actions, her latest interview indicates substantial unawareness of the severe consequences. This absolutely confounds me, as Indigenous communities have experienced significant harm as a result of access to their language being removed. In another recent article, subtitle, the following quote is attributed to Deborah Auser. She says, quote, "When you disrespect the interpreter, you disrespect the deaf community," end quote. There has been no reconciliation, according to them. Although the Minister of Justice has known for 5 years about hundreds of disabled community members being surveilled by MPI without their or their guardian's knowledge or consent, no effort has been made to repair this harm or to ensure that it is not repeated. Some secure video links are being included. In a recent Free Press article entitled "On the Heels of Project Nova Disaster, MPI Rate Application Raises Eyebrows," Danlett writes, quote, "This year, the rate application is nothing less than a disingenuous attempt to cover up their own incompetence by taking more money out of the pockets of basic policy owners who have the temerity to file a claim. The NDP government has essentially sat by idly and allowed MPI management to color outside of the lines in ways that don't necessarily serve the public into consecutive rate applications," end quote. In my conversation with your office, I asked that your team reach out for a response from the Minister of Justice on my behalf. As there is no accountability forthcoming from any branch of this government, the responsibility is on each individual patient and claimant to simultaneously pursue health and justice. Though this includes encountering many roadblocks and difficulties along the way, and as I previously mentioned, I only have a short window to recover from surgery. So I would very much appreciate your help. I can't wait for the supports I need, and I'm no longer willing to subject myself to harm within this process. Here are some additional updates of which I feel you need to be aware in your position of Health Minister. The Office of the Manitoba Ombudsman has not yet responded to or contested anything I raised in my previous letters. No branch of government seems to have any issue with this. I've not included their office or that of patient relations when addressing this communication this time around, as it seems unproductive. The Claimant Advisor Office assigned me a new advisor to challenge NPI with the evidence I've obtained. However, they refused to provide me with any alternative method of accessing this evidence than that which will cause harm and impede my recovery, emailing large compressed files one zip at a time. This week, they missed a phone appointment with me without notice, causing my existing mental health conditions and difficulties to spiral into a panic attack or more harm. I've already submitted a 7-page document to this office detailing the ways I've experienced continued harm over the last number of years as a direct result of their failure to accommodate me. I honestly don't know what else to do. There are no other advocates available. Manitoba Health out of Province covered the cost of my 3-month follow-up consultation with my U.S. neurosurgeon, Dr. Klinga. However, although the neurosurgeon following me here specifically requested I follow up with her multiple times in the future, Manitoba Health out of Province demands a new referral for any future consultations. And considering that my local neurosurgeon will no longer be following me, I have no one to advocate on my behalf in this regard. Manitoba Health out of Province also paid my travel claim without sending me any of the appropriate documentation to receive reimbursement of the related GST through the CRA. I had to appeal and then request this from their management. Pharmacare has still not responded to any of my requests for an update with respect to my appeal for exception drug status or EDS. My progress continues to be impacted by this patient neglect. Your office said they would look into this for me as well. The spine clinic director refused to pass along any scientific evidence or educational information to any physicians, saying that they can't tell doctors what to do. This does not seem accurate from my perspective, as the doctor managed to request the out-of-province coverage submission, which I needed from neurosurgery and resulted in my virtual follow-up being covered. I'm still being compared to patients, though, who have greater support needs without any recognition at all of the support needs or significant limitations I do have. When I spoke with your office, it was suggested that perhaps the deputy minister might be able to assist with this in some way. Today, I have no local spinal specialist. My U.S. neurosurgeon specifically requested I be referred to a spinal cord injury group, such as Spinal Cord Injury Manitoba. I must continue to wait to see a specialist in spinal rehab next month before they will even consider a referral. And lastly, as I mentioned to your staff when we spoke on June 16th, I'm still awaiting a response to my 3rd human rights complaint, which has been issued against the current provincial government and specifically the Office of the Minister of Justice and NPI. I would, again, gratefully acknowledge any effort toward a response anytime. I need to access support in a way that does not cause any greater harm to any aspect of my health, but I do not know how this is possible in this province. No office, organization, or politician has been able to successfully assist me in improving with respect to health or justice. As I slowly begin the process of initiating CPSM complaints against the 5 main physicians who have caused me the most harm, I know from experience that this is likely to be less helpful than harmful. These doctors will do what the minister overseeing accessibility did: make excuses, walk back statements, and likely misrepresent the truth in their explanations. But unlike her, they will not even attempt to take responsibility or apologize. Legislation is needed to protect all claimants from unwarranted surveillance causing lasting harm and to ensure vulnerable individuals are protected from being recorded without their knowledge or consent. Additionally, all claimants need to be able to access a path to justice in a way that is accessible for them and removes harmful barriers, discrimination, and provides necessary support. In my last letter, I asked if it was really the responsibility of patients like me to educate the whole province. I believe your inadequate response mirrors the entirely inadequate responses of the Ministers of Justice and of families. It no longer makes sense for me to ask when we will be able to access the safe and appropriate medical care that we need, but I will continue to hold your office accountable and to suggest that the provincial government work together with us, patients. I must reiterate that NPI will continue to win by discriminating against people like me until they are commanded by a court process to change their behavior or until this provincial government assumes responsibility for change. It is not acceptable for things to remain as they are. I myself may very well have lost my life before accessing surgery without the support from my spouse I needed to challenge legal aid and then Manitoba Health out of province. Others may not survive in the future. And we are humans with rights who deserve all possible access to safe and supportive healthcare. Once again, I ask that you please consider my life, my rights, and my health valuable enough to take some action, and soon. Among the most significant of my losses is time, which is irreplaceable, but I've not given up hope for a healthier future. Although I've been mostly alone in working toward my post-op goals for the past few months, this reality does not need to continue. With increased education, awareness, and understanding, such as that which was offered to the aforementioned lipedema representatives, the future for patients like me may be significantly improved. I'm hopeful that even a small percentage of my tremendous losses as a result of patient neglect will be recovered. And regardless of whether or not this government decides to act or not in ways that are helpful or harmful, I will remain committed to truth and justice in any way or ways they may be realized in my lifetime. Please let me know when you are able to connect and to explore the strong potential for positive, lasting future change, because all patients, myself included, deserve better. Respectfully, Lindsay White.